Ladies and gentlemen, welcome back to the Founders Playbook from Lab to Launch. And our guest today is Daniel Bautista, Chief Executive of Symmetry Surgical. He's lived through the Lab to Launch journey, developing his technology, looking for that first believer, and taking on the challenge of turning complex research into a product somebody will actually pay for. Today, we're just going to get the unfiltered truth about the mistakes made, the lessons learned, and the strategies that actually work. So if you're an academic thinking of making the leap, this is the conversation you've been waiting for. Daniel, how are you?
I'm good, thank you. How are you?
Very well, mate, very well. Welcome to the show. Good to see you.
Yeah, good to see you again.
Let me dive straight in and say, before you founded Symmetry Surgical, you are, and still are at the moment, a researcher at Imperial. What was the core, or is the core scientific or technical problem that you were obsessed with in the lab?
So, when I started my PhD, what I was really focused on how robotics could help make surgery safer and how could make it so patients would be less scared of surgery. So I think it was me being scared of going to surgery and also a bit geeky engineer and finding robots like a very cool solution for it that drove me into that in the first place. But then during my PhD, what was really motivating me was to see how surgeons were dealing with really, really small features in the body. Sometimes they couldn't even see with their bare eyes. And how very, very small changes, 1 degree in how they would position a tool, moving a little bit slower, speeds that you cannot even notice with your eyes and with your tactile feedback, how those things would affect in the outcome of the patient. And it would make the patient hear better, see better, feel better after surgery. So just understanding how those micro changes would affect outcomes it's what was taking most of my time and was driving me during those early researcher days.
So make surgery safer. I don't think anybody's going to disagree with that. That's a good one. Less scared of surgery. Yeah, I'd quite like to be less scared of surgery. We even call it, right, going under the knife, right? It's not a reassuring process. But you're talking about, and this is not entirely reassuring, when you're saying that surgeons are doing things that they can't even see and they can't even feel. And it makes an impact on the outcomes, your health outcomes. There you are on the table unconscious. And those small changes that they can't see and they can't feel. That is a problem to solve. I very much agree with you. Really interesting. So, and you were talking and you mentioned robots. And I guess that's going to come up as we go further down. But in terms of the problem, can I just say, yes, please solve that. That'd be great. What was the problem you thought, hold on, I can do something quite big with this. I could do something even commercial. What made that thinking in your head?
I don't think it was a one moment kind of realization. I think it was a slow process. I was always very keen in investigating things that could impact surgeons or users or patients. And so from the very beginning, we were working with surgeons and trying to solve some of the problems that they were facing or some of the problems that they thought could affect eligibility of more patients, those sort of things. But I think it took some time from that early problem that some surgeons had identified to realizing that it wasn't a single surgeon team sort of problem, that it was wider. And I guess the real turning point was when we realized that we were not only proving with research evidence that there was that problem and that there was some sort of solution or proof of concept, but that the technology, the product that we had come up with was the real answer for all those people that had the problem.
You started off working with some surgeons, number one. You started to identify certain problems or investigating problems that they identified themselves. You're pulling from the surgeons and saying, well, what's the problem that you've got? What do you see?
Yeah.
But then you said, hold on, there's a pattern here. There's a wider problem. It's not just one or two surgeons, it's everyone. So you're doing a deep dive into that problem, working with the people that have got the problem. That sounds like a good process.
Yeah, so I think that's essentially, and it's mostly the approach of our lab to have that kind of deep collaboration with clinicians, and it really helps in this process. But it's also true that not always when you find a problem and then you have a solution for it means that there is a commercial business behind it. And it was just that in this case, as we work on it, as we develop more research and we were coming up with solutions, we realized that there was a market for what we were doing, which is really important because it's at the end of the day what is allowing us to push on the technology and bring it to patients.
So it was that ongoing realization that actually there's a lot of people that have got this problem and there could be something into this. There was just that build of people. Interesting, that finding that pattern. Okay, really nice. So you've talked a little bit about, look, these small changes affect outcomes. So if you were talking to an investor, which is different to a surgeon, if you were talking to an investor, how would you explain to them what is that major problem you solve and why it's worth it to them? You've identified these surgeons, right? You've worked through, that there is a problem within surgery where small changes affect outcomes, and it's really hard for a human being. Cool. That's great for surgeons, but if you're talking to an investor, how do you get them interested in that, given you're now thinking about it as a commercial proposition?
So I think, for instance, if you look at the first indication that we are targeting, so we're working with cochlear implant surgery at the moment. And so if you see these cochlear implant manufacturers, they're really focused on implant innovation, trying to improve how the patient hears a bit better with their devices. But as they continue innovating in implants, a strong focus is on bringing these devices to people with less severe conditions. So these people have a little bit of hearing that they need to preserve. So the interest is on preserving this hearing for patients. So the mechanical ability, the skill of the surgeon really matters to preserve that hearing. And an implant alone is not going to solve that, right? So with our technology, we're building that infrastructure level layer that allows to deploy this or insert the implants consistently into the patient without them losing the residual hearing. And so for an investor, we're basically, as I said, creating this infrastructure level at hospitals that allows to deploy technology or to conduct surgery in patients without causing damage, and allowing expanding into patients who right now don't have access to surgery because the surgery is deemed too risky.
So firstly, you think you can bring down the risk because there are some patients that now could get it at the moment that before couldn't. That's really useful. You're bringing down the risk, and therefore obviously that's money and that's cash, and that's really important. So there's that very financial piece that you've got to be able to translate better surgery into something financial, whether it be bigger market or smaller risk or whatever it is, for an investor to be interested in it, even something like surgery. Moving from academia to starting a business, it's quite a big leap. There's quite a lot going on there, right? What made you decide to leave the relative safety of academia and research, and it is relative safety, we know that it's a lot of short-term contracts in academia, and become an entrepreneur?
I think, truth be told, I don't think I was made an academic from the beginning. I really enjoy science. I believe I'm a deeply curious person, so I really enjoy my years as a researcher and my PhD, but I don't think long-term I was made to be an academic. But that being said, as I was finishing my PhD, I had options which were a bit more comfortable than a PhD. I could have gone to industry, working on established business, but I decided to follow the entrepreneurial path. But I think the main reason was that we knew that we had something that could be useful to a lot of people. That wasn't only an idea at that point, that it was starting to realize and materialize. And it was very difficult to put that on a shelf and continue into a more comfortable path. I think, that realization of having something that could impact so many people was very strong and very powerful to follow down that route.
Well, so if you've found something and it's the impact that you can make with that, and you're thinking, we've got to do something with this, I can't just let it sit.
Yeah, exactly.
Okay. Really good. So there you are. You found this thing. You're like, wow, excited. You can do something. This is really interesting. You can help people. You can have a massive impact. Going from cochlear and going from the ears, but then a lot more surgeries you could then spin off from that technology, I would guess.
Yeah, exactly.
So, who was the first believer? Who was the person who sort of said, "Well, listen to you, hear about this, hear this excited tone of voice," and helped you get the conviction to take the risk?
I had quite a few doubts and a couple of sleepless nights as well. So I think it was talking to my partner at the time and a very good friend after a few days of not knowing what to do and what direction to take. And they very clearly told me, like, as I was speaking, that the decision was already made in my head. I was just not admitting to it without actually telling me which one I should take. And that kind of like dissipated the fog and the doubts in my brain. And I chose the right path, I guess.
Nice. The decision's already made. You just haven't admitted it to yourself yet.
Yeah, it was something along those lines, yes.
Very nice. Very, very nice. So, hard tech is not just hard in terms of it's not soft, it's not software, but it's also hard because it's hard to do, it's hard to develop, it's hard to make happen. There's a lot more finance necessary. What was the biggest single technical hurdle you had to overcome before this was a viable product and not just a science project?
I think a couple of things. Now that you mention hard, like a big part of what we do, and I know it's not the answer to the question, but it's hardware. And it's a bit of a pain sometimes because supply chain is difficult. And when you want to iterate a hardware product very quickly, sometimes it's more difficult than you want to realize or admit. But I think for us, the most difficult part, or what took way longer than we realized, was so we had a very good thing that we've tested in vitro in our control lab experiments. But moving from there to a prototype almost product that a surgeon could use without any indication from us in a more real scenario like a cadaver specimen, that took a lot of work and effort because there is a lot of nuances that you don't realize. The level of reliability of the product, it's exponentially higher compared to our previous control experiments. So it took a lot of effort and work to get from point A to point B.
So there's a lot of detailed complication. I guess when you're dealing with cadavers, like you say, it's real world stuff. How do you bring these ideas into the real world and test them and make it work in the messy world that we live in?
Yeah, yeah.
And something that's very crucial for university spinouts. You're developing this in the university. You're still part of a university you're spinning out now.
Mm-hmm.
Let's talk about intellectual property for a minute, because that's crucial for university spinouts. And I mean, not only do you have to create it, you're creating it, you've got to maintain it, you've got to protect it, you've got to then negotiate with the university about how that intellectual property gets used by the company you're going to create. So how have you worked through that? What's the strategy around intellectual property?
We had 2 initial patents that we developed during our time at university. In both inventions, they were employees of the university, so essentially the IP belongs to the university. We negotiated with the university. They were happy with the business that we wanted to create and with, I assume, the impact that it was going to have. And so they endorsed our business and they agreed to give us an exclusive license to exploit the IP in the company.
So you've got that exclusive license. That's really good. That therefore means the investor is happy. You've got those different levels of protection, the legal protection. Is there anything about different markets that you need to think about? Or are you just focused here right now? How are you doing that?
Yeah. So I think on that sense, yes, like the university is very helpful into explaining those different paths. And we always work with the legal firm taking care of the patent. We patent in Europe and UK for reasons that relate to the inventors. And then we file a PCT a year later, and in a few months we will decide which markets we will enter, and that will be a decision of the company. But we've made sure that we've talked throughout the whole process to make sure that we don't damage the long-term strategy of the company.
You're in the university. you've talked to friends, you're talking to the Imperial Tech Transfer Office, you've got the license agreement. Thinking about now going outside of that university, outside of the product side, who was the first person outside of that university that you spoke to about this, whether it be an investor, a potential customer, and what was their reaction?
So when I defended my PhD, one of my examiners was a surgeon, and during the lunch after the defense, my supervisor at the time and my co-founder these days and I were in a way pitching the early structure of the company that we were envisioning to build. The reaction was very interesting. So on one side, it was very positive, and I didn't realize at the time because I don't think I had that knowledge at the time, but he was validating the market for us. He was explaining, he was giving very good examples of how many people actually benefit from cochlear implants, how a product like ours could really help, how many people could benefit from them, how it doesn't matter the age. And he was giving very good examples of older people that were receiving this technology, even if it was just for the last 2-3 years of their lives, and how impactful this was to them. So really personal and good conversation and advice, and helping us to realize how important what we were doing could be to many people. But at the same time, he had not a skeptical attitude, but he was also very clear in explaining how difficult it would be to realize a product that could help every surgeon and could be deployed at almost every hospital. So one side was very encouraging on how impactful this technology could be, and on the other side he was really realistic in explaining how challenging was going to be to come up with the right product.
So really useful, really good. Be great if you did it. It's going to be hard.
Yeah, I think it was what we needed to hear at the time. I think we just needed validation of us being in the right direction and trying to solve a problem that mattered. I think we had, and I still believe we have a very good team in place, and we were confident that we could overcome those technical issues or barriers.
Very nice. Very nice. We can do it. We've heard it's good. We've heard it's useful. We've heard it's going to be hard, but we think we can do it. Nice.
Yeah.
Very nice. So then how have you identified who your customers might be? We've spoken about surgeons up till now, but surgeons don't tend to buy big bits of kit. So how have you identified who the customers might be?
In our case, it's a bit clear from the beginning, right? We need to sell to hospitals or clinics, either big hospital or private clinics. And yes, it's true that the surgeon usually is not going to be the one purchasing our technology, but it's always our first point of contact and the ones that were involved in the development of the technology from the beginning. So they've always been the starting point for us on almost everything. So they were the ones who introduced us to the right people at hospitals, to have the right conversations, to realize if hospital could afford our technology, if they were interested in our technology. So yeah, that was the route to find the customer.
So you've worked your way through those networks. How did you get known? How did you get out to these surgeons, these hospitals? How did you manage to make yourself visible?
That's a very good question. And I guess at the beginning was really difficult, especially when we were just starting the research. And this was early 2019, mid 2019, just sending emails, all contacts that had worked with us in the past in different projects. Well, starting navigating that first contact and expanding from there, and then eventually finding the person that has the time, and more than the time, probably the motivation to make the time to sit down with you and to give you the advice and the time that you need. So it took some time for us to find that person, but I think we were lucky enough to end up finding the person that can propel the project to the next level.
So there's a lot of work getting emails, making contact, and building a network for yourself. Yeah, let's talk about what you actually developed, because you mentioned a robot at the beginning, and you mentioned helping surgeons make those small movements, the things they can't see, the things they can't feel. What is it you've got?
So what we have is it's a robotic platform. It's a compact robotic platform that can be deployed in the operating theater. And the idea with this platform, this hardware and software platform, is that can be in the operating theater without disrupting how current surgery is. So not adding anything, not changing anything, just improving the outcomes of the surgery and having something that is very simple and easy to use. So that in lay terms is what we have, a very compact device that integrates seamlessly in the surgical theater and is very easy to use. It's just an extension of the surgeon to allow him to or her to deliver better outcomes to patient and to be able to treat more patients.
So something that's really interesting that just came out there is how you were talking about it's almost like an extension of the surgeon. It's about it fits into their process because you can't introduce something that's completely different to all surgical processes because they won't adopt it, right? They won't use it if it doesn't fit into how they work.
Yeah. Yeah, exactly. So it's just not like changing anything, adding complexity, adding anything. It's just improving on the current process and just make it as good as it should be.
Yeah, so it's really important to have something that fits into the world as it is so that people can actually adopt it. So you're now in the process of working through the spin out piece. You're now in the process, I guess, of looking for funding. And looking for investment. Are you looking for commercial investment at this point? Are you still sticking to grants? How are you thinking about getting the money together to support the development?
We were lucky enough to get a very good grant from the NIHR that is driving us for the next 2 years, helping essentially with technology development and helping us finalizing the product to a point that we can use it in humans. But at the same time, we're starting to look into other source of funding, so looking into angels, VCs, and similars, because there are things that we need to do from the company and we cannot really do at the university, and we need to essentially speed up the process to make sure that this technology can arrive quicker to patients.
I mean, how do you find the process and how are you dealing with it? You're applying for grants, you're talking to lots of investors, and it's not easy as well with medtech, right? Because medtech is a long gestation period. It takes a long time.
Yeah.
We need a certain sort of investor to do that. So what's the process like for you?
It can affect the momentum in the company, those ups and downs with funding or uncertainty at certain points. We're on our third year at the moment. At the end of the first 2 years, we were just weeks away from running out of money. And it's probably not inevitable, but almost inevitable cycle of running out of money every time, especially at the very beginning where we were running just with small grants that were paying just the team salary and very little stuff. It's hard on that sense. On the grant side, we try to plan ahead of time so we have more opportunities. I take every grant as an opportunity to learn, and it's usually really helpful, the advice that you get from a grant. So it's kind of like an opportunity to test if you're going in the right direction or not, or what could you do to improve moving forward. Because just looking at chances of getting grants, they're very low. They're 10, 15%. So even with a very good proposal, you will get a no. And same with investors. I started very early talking to them, even when we were not ready. So I think I was just very aware that I was going to receive a bunch of no's, and I just thought that it was going to be the faster way to move forward, just than being three people in a team, realized trying to make the perfect pitch. I just decided to move forward and get a bunch of no's and try to improve a bit faster. And it, in reality, at least for us, is working.
Yeah, it's very much, you've got to learn as you go, right? You've got to, because there's other people out there you're competing with that have done this 20, 30, 40 times before and have learned some things.
Yeah.
And so you've just got to get on with it and get that painful learning through and get the nose and work out why.
Especially at the beginning, you don't understand the why. They're telling you why, but your brain is still not capable of understanding the why. So it takes a few weeks, months until you realize, oh, that thing that investor told me, now it makes sense. Now let's implement it.
Yep. It's hard. Emotionally hard when you keep getting no's.
Yeah.
So talk to me about the team you've mentioned before. You're the founder, alone or with a co-founder?
I have two co-founders.
So you've worked together. How did you find your co-founders? Who are they?
So one of them used to be my supervisor. So he's the co-founder on the scientific side of the project, which is very important for us as we're building an evidence-based product. And the other co-founder was one of the first clinicians that started to work with us and with whom I've worked for many years now. And yeah, so they are the two co-founders that started the business with me.
Kind of dig deeper a little bit into that for a minute. So one was your supervisor. You are, for example, if you've got two other people, you've decided to say, right, I'll tell you what, guys, let's build a business. And you've been together now for a while. So what makes that work? I mean, co-founding is like a marriage. You've got to, you've got to keep getting on with that person. You've got to be able to argue, disagree, and yet keep going on. You've got to be able to be really honest with each other. You've got to be able to set a culture in a company and an organization that would work for all of you.
Yeah.
How are you making that work?
I think it comes back to what I was saying earlier, especially on the surgeon side, where we start to get some clinical help, and then there was that search period until we found that person that would have, and again, it's not the time, but the drive to make the time to help us. And so I think that ingredient was there from the beginning. And so that helped to create a very good relationship, a trusting relationship where we could work very well together and trust each other to the point of going and building a business together. And I believe that with my supervisor was the same. We had a very honest relationship. It came naturally from the beginning. In our case, it was very, very easy for us to work from the beginning and to decide to continue working together. At the same time, we have very complementary skills and at the same time essentials, in my opinion, to build a medtech business. So you need a clinical mind and you need a technical scientific mind into the team, and I guess you need me as well.
Yeah, you probably need you as well, don't you? Yeah, I think you probably do.
I hope so, yeah.
Very nice. Okay, so there's something about those matching of different skills and capabilities as well that's important in that team that you're describing.
Yeah.
You've started with the technological investigations back in, I think you said 2019. So that's already like a 6-7 year journey, right?
Yeah.
But it's not unusual in medtech. Medtech takes a while, we know that. So looking back over that, and now you're at the point of spinning out, which is very exciting. Looking back over that 6 or 7 year journey, was there anything you'd go back and change if you could, a decision that you made that you think, well, I could have done that different?
The first 3-4 years was primarily research, and I don't think I would change much of it. I think it was a great kind of exploratory period. It allows me and the team to learn more about surgical robotics and the nuances of it and a lot of things. So I think I wouldn't change any of that. When it comes to the point where we decided to spin out and to start working on the company, I think what I would change is the fact that the very beginning I was the only full-time person working on this. And when you decide to start a business, you start like, or at least is how I did it, take notes of everything that you need, try to make a plan out of it, starting getting some dates on when you should bring this to market. And all of a sudden you just have a million things to do. And you just think that you need to do a lot and at the same time. And I know it sounds very obvious, but at the time and in that moment, it wasn't. So just doing so many things at the beginning wasn't the best choice for sure. And if I was given the opportunity to go back, I would definitely be more selective and do a few things at a time and do them better and do them sequentially. And I think it would allow us to progress faster than we did by trying to do 1,000 things at the same time.
Yeah, that makes sense. Not spreading yourself thin, getting something done.
Yeah.
So that actually gives you value.
Exactly.
And the pressures, that's really normal, right? Because the pressures when you're trying to start something of getting all this stuff done, the workload is very large to begin with. Well, it always is. But...
Yeah, exactly. We were at the point where we were writing the patents on the technology that we had developed, looking for our first partners to drive the business, writing grants, trying to bring people in, developing the technology further at the same time. A lot of things for just one person to do.
Yeah, a lot of. It's hard tech, it's med tech, it's very, very different from what has been a brilliant documentation of an entrepreneurial process that's come out of the United States, come out of California over the last 15 years or so. But it's very different. It's very long term. It's not short term. It's very regulated. You're playing with people's health. So, you can't do the move fast and break things. That doesn't go down very well in health. So what have you learned that's not in that playbook? What have you learned that's not in that Silicon Valley iterative trial and error playbook? How have you managed to do that in that very different world?
We're doing medtech. We're dealing with people's health. And also, we're trying to bring the bar even higher by bringing a product that doesn't change the process and doesn't add complexity to the surgical operation. And I think the risk is that if you try to develop this too quickly and too fast, you're going to make a lot of mistakes. So yes, you need to be very focused. Yes, you need to put a lot of effort, but you need to give time for the technology. Otherwise, it's going to be very costly. You're going to have to come back and do major redesigns very late in the process, or your technology may never get adopted. So you have to give the technology the time that it needs to generate the impact that you're looking for.
So you've got to give it that bit of time, and then hence that kicks off all the other things we've been talking about. You need that long-term funding. You need to take that time. You need that technological development, working with the customers, look to getting to the hospitals, but also doing all that safety checking before you get to investors. And hence it's 6-7 years and not 3 or 4 months.
That's what in a way makes difficult the early fundraising, where you have your ways to show traction, but you don't have obviously the type of traction that other companies could have at those stages, right? And so it takes an extra effort to show that there is a viable business behind what we are doing, to convince investors and to convince accelerators and grants.
How are you doing that? When you can't say, look, here, I've already got 5,000 customers and it's going to explode to 5 million in 2 months. How do you do that in the context of medtech?
One way that we're trying to tackle it from 3 angles. So on one side, we have continuous engagement with patients. So we're trying to show that patients need this, they would like for our technology to be in the market, that they would choose our technology if it was available. We do also that through surgeons, through their engagement, and key opinion leaders that advocate for our technology. And then we work with hospitals and try to understand what would be the best way for them. Well, first understand if they would be interested in our technology, and we've been lucky so far, but also work with them to understand what would be the best model that would work for them, for our technology to get to the hospitals. And finding that evidence that surgeon wants to use it, patients wants to receive it, and that hospital that in the end wants to do things for the patients and with the surgeon have a way to actually uptake our technologies, the sort of evidence that we are trying to generate to then convince investors that our technology will have an impact and then they will have someone to pay for it.
So you're all the way along the line from patients to surgeons to hospitals to show that whole value chain to the investors so that we've engaged with all of them and this is what they're saying.
Yeah, exactly.
Was there anything that you would say was particularly useful as you're thinking this through, as you're working this through? Anything you'd recommend to another founder, a tool, a book, a process that's helped you go through this entrepreneurial journey?
There is one book particularly, it's very famous, it's called The Mom Test. That book, every page, almost every page, I was thinking, I wish I had read this before I started anything, because the first thing that you do, or that we did at least, was to talk to as many surgeons, as many hospitals, as many potential customers as we could at the beginning. And I just wish I had read this book at the beginning. So yeah, I think talk to people, read a few books. I think The Mom Test is a nice book to start with.
Yeah, highly recommended. It's a really, really good book, isn't it? And it just helps you understand the problem and not get everybody telling you how wonderful you are, but actually trying to work out if they've got the problem you're trying to solve.
Yeah, exactly.
It's really, really good. Completely agree. So, road ahead. You've already said you're spinning out. That's exciting. That's a really exciting milestone. Is that the next big one over the next 12 months, or is there another one coming as well?
So that's the immediate milestone. So we're really looking forward to complete that in the next few weeks. The process is quite advanced and we just need to close that because we want to go to start fundraising as soon as possible. So as I said, we're just trying to focus to get the product into humans as soon as we can. So yeah, spinning out and fundraising is the big two milestone for the next 3 to 6 months. But a bit more long term, you mentioned 12 months. We're looking to do a preclinical study where we want to bring a good number of surgeons across the country to use our technology. We're going to have, for the first time in the same place, a large number of surgeons testing our technology. So that's the big thing that we're working towards by the end of the year.
That's exciting.
Exciting, scary, a bit of everything. But yes, it's really exciting because it's kind of not the end of the road, but just a big inflection point for the team to put together all the work that we've been doing over the last 3 years.
Wow, good. Large scale test, love it. So that's quite, so spinning out and doing that sort of large scale testing, it's quite a critical stage. For anybody that you could help him in, investors, partners, future employees, anybody listening right now, hospitals, surgeons, what's the biggest challenge where our audience could help you?
Obviously, we need clinicians and we need clinical partners to test our technology to make sure that it works for everyone. We need hospitals to understand how they want to use our technology, how we could work together to decrease the friction for our technology to be used in hospitals. So we need a lot of help on that. We need great engineers. So we have an amazing technical team working with us already, but we need more engineers that are motivated and by this type of work and that want to help us bring this to hospitals. And obviously we need help finding investors for this type of technology and the stage at which we are at the moment. So help in every aspect of the business. So if anyone knows or can help in any of these segments, we are all ears.
Fantastic. Okay. And where can they find you? Where can they go to follow your journey, learn more about you, learn more about the company, Symmetry Surgical? How do they find you?
So we have a website that has been dormant for a few months, years now. We try to put all of our efforts on the business and the technology, but we're planning to start populating resources with our latest development and engagement with patients, etc. So I think our website it's the best place to follow the journey, and we'll try to also be active in our LinkedIn page.
So they said the website as well?
So it's symmetry-surgical.com.
And that's Symmetry with an I, right?
Yes.
Symmetry with an I, -surgical.com, ladies and gentlemen, which we will have in the show notes. And how can they get in touch with you?
I think LinkedIn is the best way. Through our website, we also have an inbox where they can email more general questions, but I'm always available for a chat, and LinkedIn is probably the best way for it.
Right. So what we'll do is we'll have your LinkedIn also on the show notes so they can get in touch with you. Daniel, thank you so much. Fascinating journey. Really interesting because medtech is different to almost everything else. It's so highly regulated. It takes time, and you've got to have that determination to push through that and make something that you've now got to the point where you're spinning out and you're going to have these large scale trials coming up. So really interesting. Thank you so much for coming along.
Thank you.
Hopefully that will be a bit of an inspiration to other people looking at medtech and thinking, well, I'd really like to make something safer and less scary, and know that you can do it and you can push as far as you've pushed, which is great. Thank you so much. Ladies and gentlemen, Daniel Bautista.
Thank you.